Tansei, broadcasting from unceded and unsurrendered Algonquin territory, we welcome you to the First Nations Health Managers Association Town Hall Gathering. Thank you so much, everyone, for welcoming us every week on Thursdays from 1 to 2 Eastern into your territories, into your nations, and for making this the place where you come for credible, reliable, and relevant information surrounding COVID-19. We really appreciate the support in terms of being able to broadcast this also in French. So Pascal Belanger, once again, has this message for you en français. So bienvenue to our folks who are listening in French. We couldn't do this without the support of a whole team of folks. So thank you once again, Indigenous Health Today.ca. We appreciate that you're stepping up to do this. And TELUS, thank you for providing those phone lines. And APTN, you have been amazing in your support. So we appreciate you and lift you up. Thank you so much. Well, today we have an hour together to talk with Mr. Terry Goodtrack. Again, you have been amazing in your support, so we appreciate you and lift you up. Thank you so much. I'm going to ask everyone to mute their microphones. I'm getting a little bit of feedback. All right, so back to talking about who we have on our town hall today. This is United First Nations Health Exercising Partnerships and FNHMA partner, AFOA Canada, Mr. Terry Goodtrack, the president and CEO of AFOA Canada, is with us today. And you think, AFOA Canada, well, Terry's got some great messages and knowledge to share with us today about the economic responses to COVID-19 and financial literacy, etc. So thank you, AFOA. We know that I am probably your biggest fan at AFOA Canada. I have so much love for your organization, Terry, and what you are doing to build capacity. You're a trailblazer in terms of the association management, in terms of building the capacity, and I'm proud to be a certified Aboriginal professional administrator and a certified financial manager as well, designation holder of your organization. We also have returning Dr. Valerie Gideon, who is the Assistant Deputy Minister at Indigenous Services Canada, to give us the update from our government partners as well. So you guys know the drill. If you have questions for these spectacular panelists regarding COVID-19 and you feel this is the format to do it in, make sure you send those emails to fnhma@ihtoday.ca, and we'll get to the broadcast of those questions shortly. Another reminder that we also have Info Point. Info Point is the place where we'll pick up the phone, we will respond via email to your questions. If you're looking for us to navigate all of the resources around COVID-19, please give us a call at 1-855-446-2719 or send us an email at infopoint@fnhma.ca, and we will rapidly respond to those inquiries within 30 minutes. So without further ado, welcome Mr. Terry Goodtrack, a fellow Saskatchewanian. It's a pleasure to have you on the FNHMA Town Hall. Welcome, Terry.
Thank you, Mary.
And Terry, you can jump right in and get us started with your dialogue.
Okay, well, good morning, good afternoon, good evening, everybody, wherever you are. This discussion I want to just bring light to is, just trying to put everything in context of what we've been through, and kind of share, I guess my thoughts on where we probably should be heading and and as communities give some consideration to things that we may want to do, right? I think, what we've been through as a collective, whether that be mainstream Canada or Indigenous communities, is, at the beginning we were obviously surprised, shocked that this is what happened, right? Back on whatever it is, March 12th or so forth. And there was a lot of, I would say, sort of upset, people losing their jobs, anger, and there's some of that stuff that's certainly still going on and resonating, across Canada, across the world. But then, at some point, we have to start thinking about the future. And I think, while a number of our communities are still going through this, I think we've grown to come to some acceptance of where we're at, right? And in one of my previous jobs, I was with the Healing Foundation, so many of the people who are in health would recognize that sort of framework that I just used, right? But we've come to a part now that we've kind of accepted this, right? And now the question becomes, how do we move forward, right? And where do we move? Right? The only kind of financial term I'm going to provide you is gross domestic product. And my wife always says when I start talking about this is talk Sheldon to me, right? That's Sheldon Cooper on the Big Bang Theory. So I'm just going to quickly talk about what that is, and that's the only one that I say. So gross domestic product, and you hear that word all the time in the media and so forth, and this represents consumers spending, business investment, and government transfers. Three examples of that. Now, it's interesting because at RBC, they do research papers on this, and one thing that they mentioned is they thought that the gross domestic product essentially dropped 18%. And the question becomes, from an economic point of view, how long is that going to last before the economy rebounds? And then how long is it going to take for us to get back to where we were before we start growing again, right? And that's essentially the big mystery. Probably the economists are now saying that it'll probably last a year, right? Sort of as we kind of move through this trough, they call it, and then start rebounding. And you see if we're kind of opening, I guess you could say, the economy. The question becomes: is it a U? Is it a W? Or so? Right? Now, why is this important to us? Well, we have an Indigenous economy, right? And we have an Indigenous economy made up of the same elements, obviously, right? Spending, government transfers, and our business investment, right? And what we do know is that the economy, the mainstream economy, is going to change, and it is changing. You start seeing things that are very online, very technologically oriented. Companies changing their business models, a different way of doing business, just as we're doing here, sitting here in our remote environments, right? Before we go back to the office, and that may even change itself in many organizations, right? Now, the interesting thing about when the economy changes and shifts like this is that any time that there's some type of an innovation, there's always a segment of society that gets left behind. And I would argue this is that, this is a point and juncture that as Indigenous communities and Indigenous individuals that we can't allow that to happen, right? We have to keep pace with mainstream Canada coming out of this. And how do we do that? Right? We already know sectors that in the economy that you could call they're casualties, and then you have sectors that are clear winners, right? I mean, those ones that are sort of casualties are obviously things like the hospitality industry took the brunt of the crisis, personal care services, whether that be hairdressers, those kind of things, right? But there were clear winners in this, right? And the online delivery is certainly one. Technology was certainly one. Agriculture, and I think in communities you hear more of this notion of food security, right? How important that is, not just for for supply of food, but the nutrition that Indigenous people need and require, right? And I think infrastructure is another one that's very important, but infrastructure is more along the lines of the information highway, and I think that's a really important aspect too. So what we need to do when we come out of this is we really need to ensure that what I call our economic wing and our communities really start considering these areas, right? I think just earlier on before this discussion, we were having a conversation about PPE stuff, right? And there's actually an Indigenous company in Australia that Sean Andrews runs that really did PE, right? And he was telling me that they had 4 million of these N95 masks, and within 2 weeks, they only had like 400,000 left, right? And people were calling and so forth. So it's these are opportunities for this, right? So we're seeing the importance in all of this in focusing on the right sectors. But I want to underscore something that we really need to do, which is we need to ensure we invest in our human capital. We cannot allow, we have to upskill and we have to reskill. We cannot allow to get left behind in this. And the good work that Marion's group does, in the health area, this is our opportunity. People talk about lifelong learning. Well, it's not it is critical now that we start moving in that direction. As the economy changes and will change as we're moving forward. So we're seeing the importance overall of health services, frontline workers. We're seeing the importance of financial capability. I think the money organizations are realizing how cash is king, right? We get budgets and that kind of stuff, and the cash that comes behind it. How do a lot of your internal organization is managing cash right now, and cash is different than managing budgets, right? And and that cash comes with your payroll. That's an example, right? So and the relationships that go with that is really critical. What suppliers that you focus on, what relationships are key to your organization, right? There are strategic alliances, right? Whether you're going, sort of in terms of your supply chain or going forward in terms of your service delivery. We also see the importance, obviously, of technology, and I think the other part that's really come to the forefront is what I call belief systems. The interesting thing about this is sort of us starting to see some of our belief systems come to the forefront. One that I would share with you is the idea of interconnectedness. That's always been a belief system of Indigenous people, right? How we're connected to the land, how we're connected to the air, to the water, to ourselves, to each other, and so forth, right? And I think this disease, this germ, has really shown us. It already showed us in the financial crisis in 2008, but certainly it shows us now how interconnected we really are, right? And I think the other belief system that's really come to the forefront is this idea of leaving nobody behind, right? And you start seeing that, like on TV, you start seeing that in things like when they're talking about the old folks' homes and that kind of stuff, and some of the things that are going on there, right? And the unacceptability of it, right? So it's interesting that the belief systems are starting to, I think, move more to the type of things that we think of, right, as Indigenous people. But there was this this mayor in Chicago that used this quote, and I think it's something that we should all reflect on. It's this idea of let's not waste a good crisis, right? So right now, we have an opportunity to learn a lot from what had happened and what is still going on, and how we should prepare for the second wave, and perhaps there'd be a third one. And the other thing that they're telling us, of course, is that there's future ones coming, right? And again, it's interconnectedness, right? It's just, that's the way it is. So it shows us the need for things like business continuity plans, right? How do we carry on our operations, whether that be internal and health, to withstand, to be more resilient, right? We're to be able to move quickly from an office environment to a home environment, to be able to ensure that our key mission critical systems operate. So business continuity plans are very important. We also see how important emergency measures plan are, preparedness and that kind of stuff, right? Whether it be pandemics, whether it be floods, whether it be fires and so forth, earthquakes and so forth, right? How key that part is, and how key communications is in that. We see, as I mentioned earlier, the management of cash flow, right? And the importance of, of sort of ensuring that we have, even as an organization, sort of a fund that we can tap into, right? that'll cover us in times like this, right? If you looked at it from a very individual fund, people in personal financial literacy will talk about it as a rainy day fund. At an organizational level, we have to be able to withstand these type of shocks as well, right? It's our organization have to focus on the key sectors, reskilling and upskilling. But I think what we have to do is start thinking about investing in technology, not only just the tools but the technology itself, but also the tools that are available. One thing that we've learned through this is how many tools are actually out there that we can actually use, right? And internally at AFOA, what we're doing is we're using smart sheet to do work planning, right? And I love the tool, right? But there is this thing, just to caution everybody about micromanaging. So, you got to resist the temptation, right? And ensure that we have trust in our staff to deliver on the results of the work plans. And again, I think whatever sectors that we get into and so forth, it still has to be consistent with our values and our beliefs, right? And every community should have that conversation about what that is in their community. But I also think what we need to do is shift our mental models. There are certain things going forward, that we need to do, but there are certain things that we certainly need to leave behind and ensure that that those things aren't carried forward, right? I think a very trite example would be something like saying, we spend so much time monitoring whether a person is actually at their desk working, right? They're punching a card or something like that, and I get that, right? But we've got to find a way to move to deliverables and the quality of that work, and how do we ensure that that's what we're monitoring, right? And ensure that that's in our performance appraisals. So it's a trite example, but it makes the point of shifting in our mental models, right? Leaving certain things behind. I think very clearly when we get to things like the future of work, we're clearly seeing that remote work, it's possible. We're seeing in communities the big gaps that happen in technology that we need to address, so that our frontline workers in our communities have the tools to do their job, right? And let's make sure that one thing we do is ensure our communication plans and our policies are up to date. Communication in particular is ensure that people are aware of what it is that the communities your individual community is trying to do and trying to achieve during this time. So I'd say those are really good things that I think we need to consider, so that we ensure that we don't waste a good crisis. But it's important to learn from what we just went through, and to be able to get ready for the second wave and so forth going forward. One thing Marianne kind of asked me to speak about is this idea of the connection between health and finance. And I said, like, one thing obviously talk about is financial literacy / capability. And I like talking about capability more than I do literacy, because people sort of talk about, when you say literacy, you say you either have it or you don't, right? But there's a lot of connection in there, because without sort of let's call it the management of your money, it causes a lot of stress on people and families and communities and that kind of stuff, right? In terms of sort of managing your credit, paying your bills, and that kind of thing, right? It's interesting. The Financial Consumer Agency of Canada does a lot of research on this, right? And they come up with key statistics on when people do the proper sort of personal budgeting and that kind of stuff, how much more that impacts their financial wellness. I typically don't like speaking of that, because it always delves into this discussion. People tell me, well, why? I know that. Why are you telling me that, Terry? Because it's almost like you're telling me that I need to lose weight, right? And so what I'd rather do is have a discussion on things in four bubbles. One is this idea, again, learning how to manage money, because there's many different levels of this, right? From very basic to very complex, and there's many opportunities to learn how to do that, right? Whether you're learning how to open a bank account, whether you're learning how the parts about a pay stub, your group insurance, to investing, to investing in your own portfolios, your retirement plans, right? That kind of thing. But a second bubble on this is this idea of financial inclusion and ensuring that we are included in Indigenous people, sort of in the banking industry, to open the banks or bank accounts to be able to participate in the larger economy, right? But I think when you take a look at a third bubble, it's that idea of financial resilience, and this is a good example of what we went through in terms of financial resilience, and the reason why we need to put funds aside. And it's easy to say that, but everything comes down to a person's worldview on this subject, right? Person, if you're sitting there and you're on, you know, you're getting sort of social assistance and so forth, that's a different worldview than someone who's, sitting there has a office in the band council and so forth, right? They're different worldviews, but at the same time, it's finding those opportunities of how you build that resiliency, right? So that's it's certainly something that can be done. There's a broader social objective on this, which is, how do we move Indigenous people from poverty into sort of what I call the middle class, right? And to do it through financial capability, right? And the strength in that. And then finally, a fourth sort of bubble in this area of financial wellness is financial stability, right? And that's the whole part about growing assets over time, but also in there is retirement and the whole idea of wills and estates and so forth. At AFOA Canada, we have a number of products in this area, right? Certainly we have for youth, right, which is dollars and cents, and sharing with them sort of the how to manage money and introducing key concepts to them, right? But there's also, we also have high impact projects I call it, on things like lump sum payments, right? We provide training on that. But we're also coming up, we're right now doing one on the CBITP program, which is the volunteer income tax clinics right across the country. So, and I like that project, and I get the the treaty issue on tax. I understand it completely. But for I would say for a family, on reserve and so forth, to be able to access those benefits, because that's where the benefits roll through, right? To leave it to their choice, right? And then finally, we are doing a product just recently. We'll be giving on the role of executor on wills and estates, right? And I really like that high impact project as well, because this I think wills and estates have the potential of really disrupting our communities and families and so forth like that, right? We need to get our heads around that area. This is probably the first generation we've had something. It may not be much, but at least we've had something. So I think we have to really start considering, wills and estates and so forth as part of our overall financial wellness. So I'll leave it there, Marion. Thank you very much. I really enjoyed sharing with some of my thoughts. I hope it spins some ideas in your mind, but it certainly has some ideas that I think we certainly need to consider. So thank you very much.
Thank you so much, Terry, for participating in the FNHMA Town Hall. We really value the partnership that we have with AFOA Canada, and it really, again, just shows partnerships in action. Terry touched on some of the products and services over at AFOA Canada, and Terry's leaving us at 1:45 because he does have something that all of you should participate in. So to all of our listeners and our viewers, I just want to let you know that there is an AFOA Canada webinar right after this one at 2 p.m. And AFOA Canada has been doing these for a couple of weeks now, but today's topic is returning to the workplace. So you have an opportunity to ask the experts, and you can find that information about AFOA Canada's webinar or watch it at AFOA Canada Facebook and on their YouTube channel as well. Terry, thanks for putting out great information. This is one that is a hot topic right now. So very much appreciated AFOA Canada for leadership in doing this work. I will keep you around though in case we have some questions for you, and I'll make sure to put your questions at the front end. A reminder for questions, please give us an email if you have one at fnhma@ihtoday.ca. The other thing I would like to note is new star blanket today for all of the viewers that tune in every week. And actually, this was in recognition of Terry being with us because this is a star blanket that I was given when I received the AFOA Canada National Leadership Award from Pi First Nation. So, Terry, this one was for you. And it's also an acknowledgement for two Saskatchewan folks who made their journey to the spirit world. I want to say condolences to the family of Seal Tournier, OCAP warrior and champion of First Nation Health Services, another recognition of the important work that she did for us. Also, one of the FNHMA members from Pipot First Nation passed as well. She made her journey to the spirit world last month, and that is Glenda Sugar. So, to the Sugar family, our hearts are with you, and thank you for always being a part of the FNHMA family. Now, I will let you know that we have, once again, Dr. Valerie Gideon with us from Indigenous Services Canada. Valerie, thank you for so much support to the FNHMA and for participating in getting the messages out on COVID-19 during the FNHMA town halls. Welcome back, Dr. Gideon.
Thank you so much, Marian. It's always an honor to be invited. I would like to start by acknowledging that I am on unceded, unsurrendered, traditional Algonquin territory this afternoon. And I also want to acknowledge the FNHMA member and pass on my condolences to her family, the Sugar family. I did not know her, but I do want to also acknowledge Seal. Seal was a mentor to me. Met me when I was very young. She would have said very naive. She taught me what OCAP was all about. And she also taught me not to believe anything that anybody from the government ever says. So here I am speaking for the government. But we had I would say, a really wonderful reciprocal respect relationship over many, many years, and co-chaired the First Nations and Mission Governance Committee before it was a center, also for many years together. And I was extremely sad to hear about her passing last week, but we'll honor her with respect to the work that we are doing every day. So I have been asked to provide an update. I want to thank Dr. Evan Adams for participating on behalf of Indigenous Services Canada last week. We will continue to provide updates to you. Thank you to the First Nations Health Managers Association for enabling us to have access to this platform, to provide information and also answering questions. I do want to encourage you to use the InfoPoint service. This is an incredible opportunity for resources to be provided to you in terms of information, in terms of access to supports, and if there is a need to also contact the department, then absolutely, InfoPoint will get in touch with us. They have a direct line to us. We have given them access to all of our literature, all of our guidance documents, communication that our regional offices have also issued. So I just really want to put a plug in to the InfoPoint service that FNHMA is hosting. So I will just say a few things in French. Je veux juste vous remercier encore pour l'opportunité de nous avoir cet après-midi. Je veux aussi juste reconnaître les efforts des Premières Nations dans les communautés francophones à travers, bien sûr, la province du Québec. Je suis moi-même Micmac de Gaspésiac, de la Première Nation de la région de la Gaspésie. Et donc, je veux vous souhaiter une bonne après-midi aujourd'hui. So in terms of just some updates from our department. We are at 212 tested positive cases on reserve in provinces, First Nations communities across Canada. There are 176 cases that have recovered to date. 20 hospitalizations, and unfortunately 4 deaths. Now, unfortunately, as you know, we do not have disaggregated data nationally off reserve or in the territories, but it is exciting to see that First Nations in Ontario, in Alberta, in BC, in Manitoba are starting to receive information from their provincial counterparts with respect to some tested positive cases if they have occurred outside of community or in an off-reserve setting. So that is very exciting, and it is under the OCAP data sharing agreement relationship. So in honor of Seal as well and her tireless work, I wanted to acknowledge that. We have seen over the last 3 weeks flattening of the curve with respect to on-reserve tested positive cases. You can see the epidemiological curve information now on the ISC website. It is updated on a daily basis during the week, Monday to Friday. And so that it will enable you to see what it is that I'm speaking to on a regular basis. Overall, we would say that the proportion of the First Nations on reserve population that has been affected by COVID-19 is lower than the average Canadian rate. But that being said, it is largely due to the fact that First Nations communities have been extremely proactive with respect to closing borders to non-essential travel. And although we know that some communities have now eased some of those travel restrictions and have opened up some of their workplaces and so forth across the country, we still remain at 376 communities as of this morning that remain closed to non-essential services. So what I would like to speak about today in terms of the update is the work that is being done by federal departments, including ourselves, to look at guidance for easing of public health measures or public health restrictions, I should say. And what are the types of considerations that communities should consider before they actually make these decisions. We have shared a draft guidance document with First Nations, Inuit, and Métis partners, certainly at the national level, for feedback. They have shared it also with their regional representatives. There is also a public health working group specific to remote and isolated communities that provides special advice to the federal, provincial, territorial special advisory committee on COVID-19. That committee has First Nations, Inuit, and Métis representatives on it. It is chaired by Dr. Wong, a regional chief Adamic from the Yukon, and also Dr. Andrew Corvo provides very important support to that group. And they have also been providing feedback into that document. We do hope to be able to publicly release it officially very soon. We are continuing to invite some comments on it at the moment. But really, it is not intended to be directive. It is intended to guide community decisions. And so what I'll do, although we have not a huge amount of time, is I'll just speak to some of the basic principles of that document. So it talks about supporting community leadership to make decisions in their current context and based on the information that they have at hand, which is very important. Of course, we want the decisions to be as much as possible based on the evidence that we know from a public health or science perspective. But it is also important to think about coordination. If there's an opportunity to coordinate among neighboring communities, whether those are First Nations communities or not, to try to encourage that type of collaboration, it can be very helpful. Of course, it's very difficult for a community to take measures that are very, very different than their neighbors. That can cause a lot of questions sometimes from community members and make it more difficult for leadership to maintain community will and engagement and also to continue to follow the leadership direction. So if there's an opportunity to have some collective discussions around what should be done among communities, that would definitely be encouraged. It is, of course, important to remain flexible and to also take into consideration proportional risk within the community and for each of these communities that are not all in the same circumstances. The gradual adjustment of measures we would advise really be culturally grounded based on the strengths within communities, and also consider, of course, First Nations ways of knowing and doing and respecting and honoring traditional practices such as ceremonies. Those are elements that are not necessarily considered through broader federal or provincial or territorial public health guidance, but is extremely important for First Nations communities. Other, of course, considerations would be the extent to which a community is remote, the higher incidence of comorbidities in a community, and also whether or not the community has access to healthcare services and to what degree of access they have access to those services. Taking a gradual and a stepwise approach that remains flexible, and communicating with community members so that if you do see that there are some negative impacts to decisions or measures that have been taken, then there's an opportunity to adjust. But that it relies on very good, effective communication, two-way communication between those making the decisions and those that are impacted by the decisions, so that they know that this may not last. We may have to go back and put in place stricter measures if community members become ill. Being mindful of outbreaks nearby, especially if communities are closer to larger or industrial workplaces or work sites, having had those conversations with those private sector partners to understand what measures are being taken, including if the community wants to continue to pursue infrastructure development within their community. What measures are being taken to ensure, for instance, that contractors will have a self-isolation period, for instance, of 14 days before they come into community. We are doing that now, for instance, with ISK employed nurses. They are doing a mandatory 14-day self-isolation, and we are providing private transportation charter services for them to come into a remote community, and extending their shift to at least 4 weeks in a community to minimize the in and out and the risks to which community members might be exposed as a result of that. So the Public Health Agency of Canada is looking at various criteria for the broader community to consider in terms of assessing readiness to reopen. That includes elements that I've talked about in terms of the principles, but essentially, is COVID-19 transmission controlled? Are there sufficient health system and public health capacities in place? So that can include access to testing, but also access to medical transportation, medevac services, specialized hospital-based services if community members get acutely ill. Also, if you are opening up your workplaces, are there physical distancing measures that can be implemented? Does there need to be some minor capital renovations or modifications made to the workplace to ensure that it is safe? What about personal protective equipment? Now, we, of course, maintain a stockpile of personal protective equipment for First Nations communities, healthcare workers, those working in elders' lodges or long-term care homes, as well as for caregivers or family members that are particularly vulnerable, for instance. But there is an ability also to access other forms of personal protective equipment directly through suppliers. For instance, the guidance now with respect to more flexibility in terms of facial coverings, and non-medical masks. There are a number of businesses that do offer the manufacturing of those, including, and we would strongly encourage looking at Indigenous businesses that have done that through either 3D printing or actual manufacturing of non-medical masks. So considering those for your community workplaces. I would say those are the main areas of criteria that I had not touched upon before, but we will, in the guidance document, also provide some specific indicators and some adaptation measures that communities can also draw upon. And although we've not yet publicly released this information, we have provided it to the Health Managers Association to support any inquiries that you would have if you contact them through InfoPoint. So I also wanted to mention that. Before turning it back to questions, to Marianne for questions, I also just wanted to say a few words about long-term care So there are 62 facilities across First Nations communities that support elder care. So that can include elders' lodges, personal care homes, as well as long-term care facilities, 26 of which are licensed by provinces. We do know that the virus has had a disproportionate impact within Canada as a whole on the more elderly population. That has not been the case with respect to tested positive cases on reserve, and we would like to, of course, all keep it that way. We understand that the loss of an elder in a community means so much, the loss of knowledge, the loss of wisdom, of traditional teachings that assist the entire community in terms of its strengths and resiliencies. We also know from our experiences that communities demonstrate a tremendous amount of love and support for their elders. And so, where their elders are currently residing, if it happens to be in a facility that is community managed, we would like to ensure that communities are well supported to reduce the risks of COVID-19 in those particular facilities. From what we know to date, and we have reached out, is that communities have taken very important measures already to protect their elderly or their older population, as well as to protect long-term care workers as well in their facilities. And there are some best practices that have been shared online by some of these communities as well. But of course, the pandemic is not over, and public health measures continue to remain of critical importance. And so we have reached out to the First Nations Health Managers Association to explore an opportunity to provide some more tailored information, education, and training for those particular facilities in First Nations communities, ensuring that specific trainings would be offered and that we really foster community-driven solutions, but offering that extra support, whether that also includes personal protective equipment, infection prevention and control measures, as well as mental wellness supports for those that are in the facilities and potentially limited in terms of some of their family contact using more virtual means of communications, but also for the workers that are working very, very long hours under more difficult and stressful conditions. So stay tuned for some of this collaborative work with the First Nations Health Managers Association. We are very excited to continue our partnership with them. And then finally, just to note that, of course, there was a new announcement of funding $75 million, a top up to the $15 million that had been provided for urban, off-reserve, regional, Indigenous organizations and communities through the Community Support Fund. So those organizations that had submitted proposals initially, applications through the request for applications that had closed on April 13th, will be contacted as well to see what their needs are, and so that we can expedite the allocation of those additional resources. We are also producing an updated community guide for funding for First Nations communities. We had produced one several weeks ago now. We are at a different phase of the pandemic, and so we would like to reflect that in terms of providing guidance to communities that are seeking access to additional funds to continue to implement their pandemic plans. So that would relate to security, for instance, that would relate to continuing to have surge capacity in the area of health and potentially other areas in the community that are critical to maintain their pandemic measures or their pandemic plans, childcare, occupational health and safety for community workers as well, employees. And so those are all areas that will be clarified in the updated community guide, which we hope to issue very shortly. And with that, I want to thank you again. Merci beaucoup. And Marianne, I'll turn it over to you for questions.
Thank you so much, Valerie. Just before Terry runs to his webinar, Terry, just quickly, what kind of services does AFOA Canada have regarding cash management and financial literacy for those listeners and viewers that we have with us? And where can we find those that information? Is it your website?
Yeah, you can find the information. All of our webinars actually that we run so far is on our website. So www.afoa.ca. So you can access our information there.
Thank you, Terry. Again, thank you for being with the FNHMA Town Hall today. This is partnership in action. It's not every day you see associations sharing information about others' webinars, and we just need to come together and get the information out there that's needed. So a valued partner, Terry, keep up the amazing work. And I'll let you run to your webinar now, and we'll stay on with Valerie. So thank you, Terry.
Great. Thank you very much for this opportunity, Mary. Bye now.
Oh, great. See you on the golf course, Terry.
Right.
Okay, so just a couple of little housekeeping notes, and we're going to dive into the inbox for a couple of minutes. So FNHMA, you're hearing for the first time that there's a potential collaboration, a further collaboration, I should say, with our valued partner, Indigenous Services Canada, around long-term care and some tools and teachings that we are going to put together. So stay tuned for more information about that regarding the long-term care information and education. We will continue to share resources that Indigenous Services Canada has provided to us. Speaking of a resource that FNHMA has, it's one of our hottest publications, the most asked for. And I bring this forward now because we talk about pandemic planning. Well, the number one toolkit and publication that people are asking for and have been asking for is the Community Health and Wellness Planning Guide for First Nations. You can check out the new videos that have been developed to walk you through the community health and wellness planning journey. And you can check those videos out in short segments. It's easy to watch. They're going to be on the FNHMA YouTube channel tomorrow. So please watch for those. Obviously, planning is planning, and there's no better time to look at your plans than right now in prep for what needs to happen come fall for those second and third waves that we're talking about. So again, Community Health and Wellness Planning Guide, the videos, and they'll be on the FNHMA YouTube channel. If you have further questions for us, send them to fnhma@ihtoday.ca. Let's check out the inbox. And Valerie, you know that the questions are coming over to you. So we'll get a couple in and then we'll go into all of the thank yous and the stay tunes. We have an exciting announcement for everyone on June 11th. Mark that in your calendar. So FNHMA Town Hall, June 11th. You don't want to miss this announcement. A little teaser for you. All right, Valerie, Dr. Gideon. I feel like we've known each other for so long that I forget that you do have a title. While it's not a practicing physician, I do respect your credentials. Can you tell us, from your perspective, is there any significant gaps in PPE goods and services for communities, needs on or off reserve? What do you see from the lens that you're sitting at, Valerie?
Absolutely. And I think, what the main questions that we're receiving now is now that there is more public encouragement for the use of masks for a broader population base than just for healthcare workers or people that are providing immediate care to people. I think people are asking, okay, so how can we support our community members to have access to those facial coverings, right? Non-medical masks. And I think that that is the main question that I'm getting is, are we able to access funding to be able to supply those for our community members? We want to ensure that people have access to them, and some businesses are making them mandatory before you actually walk in the door now. So it is becoming an absolute need. So I mean, I think the answer is yes. We are hoping that people will submit their requests to the regional office. We cannot provide them through the stockpile that we have because the stockpile that we have is really protect the integrity of essential healthcare services and to ensure that those healthcare workers have those PPE. But we are able to provide funding for communities that do want to ensure that either their workers beyond healthcare workers or their community members do have access to those. On the off-reserve side, I certainly have heard that some organizations such as friendship centers or other organizations, midwives, for instance, that were practicing in some urban centers, were having a hard time accessing personal protective equipment. It's not been even. There are circumstances where they have been able to access those from provincial suppliers, from provincial public health organizations. But some other organizations have not had that opportunity, or there's been a big lag of time. And so, if they have had access to funding through the Community Support Fund, they can use those funds, but that's also not always been the case. So I would say that that's where we've seen some new requests coming in and also some unevenness in terms of coverage. The good news, though, is that now that the guidance for masks has broadened to enable non-medical masks and to enable organizations or companies very small companies to actually manufacture those, it's making those supplies more available to people. And so you're not necessarily looking at bringing in masks from other countries, right? It's something that you can purchase, and we've done that. We have actually, the non-medical masks that we are using and we are supplying to nurses when they're chartering up to go to community, or non-medical masks that we've purchased from an Indigenous business. So that is what I would recommend to people, that they look at that. If it's not, if it's not medically required that they have another form of mask, then that is the easiest solution, I would say, and likely the fastest one.
Thanks, Val. I appreciate your shared wisdom on that. It's a question that comes up every time we chat. It's around PPE, masks. I'm going to throw one more question over to you, Valerie, and that's about. The question is do you have thoughts around the necessity of contact tracing as a precursor to reopening? Now, I recognize you are not a physician, and so if there's a follow-up you want to do for us to share next week on the town hall, we can do that. But if you have a comment, Val, and if it's no comment, that's fine too.
No, absolutely. I mean, I think the Public Health Agency of Canada, when they're looking at guidance for easing public health restrictions, one of the criterion is the COVID-19 community transmission controlled, right? So in order to know that, you do need to ensure that if you've had tested positive cases in your community, that contact tracing has been completed, that those contacts have been tested, right? And that's a very important threshold to have crossed in a community before you would decide to reopen certain spaces. And so, in northern Saskatchewan, where they've had an outbreak situation, they have really expanded their contact tracing and their testing in order to be able to successfully manage the outbreak. Contact tracing is an extremely effective measure, and we've seen it in a number of the communities that had cases in March or April, particularly in April, where because and due to the effectiveness of contact tracing, they've not had any new cases in weeks. And so that is absolutely the foundation for communities to consider.
Thanks, Val. And I think I'll go to one final question from the inbox here, and that's just around what the shipments have been like to date in terms of the PPE that FNIB has been able to do. Is there future goals on that, or is it as an as needed and requested basis? So back to you, Val.
Absolutely, and we do publish the number of shipments on our website Monday to Fridays, because it changes every day. So as of this morning, we had 855 PPE shipments that had been completed since really mid-February. And we also know that the BC First Nations Health Authority in BC, because they have that direct responsibility, have also made 325 shipments of personal protective equipment. And so it's a significant amount. We can, if people are interested, they can email me. We can provide a number of actual product in terms of gloves, in terms of masks and so forth. I don't have that right now in front of me, but it is something that we can share, and it is across the country. It's not in one region or another. We have been doing this really regularly across the country. The way that it works is that we'll ship a 1 month supply, and people will resubmit constantly, right? In terms of like what it is that they need, because it could be very variable. If all of a sudden they've had cases in the community, they would be using their PPE potentially at a higher utilization rate. So it's not something where we would cap it, and it's not something where we could predict 100% in 6 months. This is exactly what it is that we're going to have shipped out. And we are reliant on communities, particularly where we do not have staff that are working in the health facility, to monitor very closely their PPE stockpile and supply, and to be very proactive. You don't want to wait till the last minute. We still have to ship. So we still have to, package the order and ship it. Canada Post is an excellent partner and is doing great work for us, but there still will be a number of days before it'll actually arrive. And my last point on this is we do our best to contact communities to let them know when the shipment has arrived, and we do our best to ask for a point of contact. But we have had situations where there's been a lag of time before communities have picked up their supply. So it's very important also for communities to ensure that they are aware of when it's arrived and that they pick it up right away, so that they bring it to the health facilities, so that the healthcare workers know that the PPE is there. So it is an iterative process. We are replenishing our stockpile through the National Emergency Stockpile System, which is coordinated by Public Services Procurement Canada and the Public Health Agency of Canada. We do not do direct purchasing of our supply.
Thank you so much, Val. I really appreciate the dialogue that's happening directly with the nations to say, hey, it's arrived, go pick it up. I mean, I can't even imagine the undertaking that you and your staff are doing to make that communication happen. Speaking of continuing communication, we're excited that you're going to continue, that Indigenous Services Canada will continue to participate for the duration of the FNHMA Town Halls going to June 25th. So thank you so much for being a part of the dialogue and the sharing of information. Again, it's a hashtag United First Nations Health. And Dr. Gideon, thank you. Always appreciated. I do want to say a hello to a couple of really important viewers on the Facebook page, and that is Mr. David McLaren, Certified First Nation Health Manager, and our President. David, thanks for tuning in. Darlene, another Certified First Nation Health Manager and Board of Director for Atlantic, you're with us all the time. Thank you for demonstrating your leadership and being the amazing health leaders that you are. We appreciate and value all of the 150 radio stations that are broadcasting this live as well. And of course, to everyone on the radio and to our viewers on the Facebooks, on the sharing parties that are happening, continue to watch these sessions. We have a special announcement on June 11th. We'll have back Indigenous Services Canada. We have Pegwis coming to talk with us, Akwesasne, possibly the National Association of Friendship Centers. And you continue to watch these on all the different Facebook platforms, FNHMA, APTN News, The Wolf 95.7, Eagle Feather News, NCI-FM, CFWE-FM, CKLB-FM, CJWE-FM, Element FM in Toronto, in Ottawa, Alberta Native News, thank you for the lovely interview this week. Micmac Maliseed Native News, Co-op Radio, the First Nations Drum, and of course, NCI. Thanks for broadcasting us live. A big hello to Manitoba there. Of course, MBC Radio, CKLB, and Co-op Radio Station, as well as the Wolf 95.7. Thank you to all of the listeners on our radio stations. So stay tuned for next week. We'll have Peguis Health Services joining us. A huge thank you to IH Today, Stella, Dawn, Chris at Nation Talk. Thank you so much for being wonderful partners in all of this. Of course, TELUS and APTN. I know I'm out of time, and I just want to say stay well, be healthy, and do your part in this marathon of protecting our nations. See you next week. Hi, hi.